So as usual, I give a little lesson before I take questions, just while I'm waiting for you guys to come in and filter in. And today, I want to talk about something that made national news, and it's really, for me, very disturbing. So, we've all heard about HIPAA, right? If you went to CNA class, they talk to you about HIPAA. If you're working as a CNA in your job during orientation, they talk to you about HIPAA. Everybody knows that HIPAA exists. And HIPAA isn't just related to medical. It's related to a lot of different industries, but we tend to focus on medical as well. But essentially, what it means is that you do not have the right to share information that's not yours. And it just seems like such a simple concept. It really does. And for instance, let's say that I have a child that I'm protective of, and I know that there's a lot of predators in the online space. So I make the decision not to share my child's photo on social media. That's my decision, my child. And you come along and you decide that you're going to share my child's photo because you think my child is super cute and the world needs to see that. But you don't have my permission to do that. I mean, I probably would get pretty angry at you for violating my privacy rights, where, I'm making decisions for my child. And, that seems like a very simple concept that most of us should be able to get behind and understand. And it really amazes me just how often this gets mixed up in our minds. And especially in the age of social media, right? We think that everything needs to be shared. I mean, if you had waffles for breakfast, somebody needs to know about it. We tend to overshare. So we have kind of lost that whole awareness of personal content, things that belong just to me. And I get to decide what to do with them. Because we do tend to overshare everywhere, right? But we especially overshare if it's sensational, if it's going to get us some attention. So like if I'm just sitting in my living room watching TV, I'm probably not going to share that because nobody really cares. It's not really sensational. But if I'm, I don't know, taking first place in a pie eating contest, I'm probably going to share that because, hey, wow, that's pretty cool. Look at me, right? And you have to understand when you're sharing stuff online, the whole purpose of that is to draw attention back to yourself. You are trying to get likes or attention or comments, or it's all attention-seeking behavior. And the more extreme or sensational the content, the more attention you're likely to receive. I mean, this is the whole thing about going viral, right? Going viral means more eyes on the content, more interaction on the content, and more attention for the person that went viral. We all know what these terms are, but we need to understand the purpose behind it. The purpose behind it is always attention, right? So keep that in mind, okay, when we're talking about social media. Keep that in mind. The purpose behind it is attention seeking. And that's not necessarily a bad thing. I'm not saying attention seeking is bad. I'm just telling you that in the wrong context, it could be. But that is ultimately the reason that we share things. We think it's important to us, so we're going to share it to other people, right? So let's look at a case that's currently in the courts, and I'm following this pretty closely because I think it's important. So, back in 2020, in January 2020, there was a major basketball star who was in a helicopter with his daughter and a group of other people, and the helicopter crashed, and there was a tragic loss of life. It is absolutely just horrible and sickening and tragic, and there are just no words to describe it. Now, that's a horrible thing for those families to have to deal with, don't you think? Right? So they've lost their loved ones, and there it was a whole helicopter full of people. So there's a lot of loss of life here. And it was a traumatic loss of life. And that's a horrible thing for those families to have to come to terms with. They are missing a part of their family. And the fact that it was traumatic just makes it that much worse and harder to come to terms with. Now, how do you think those people feel knowing that the first responders to that helicopter crash, the people that we trust to help us in our time of need, the people that we trust with our most vulnerable selves, how would you feel if you knew that those same people that you put trust in were showing extremely graphic pictures and videos of the deceased and the deceased body parts? I mean, that would just be, to me, that would be just beyond insult. So first of all, and this is kind of where I want to get to with this, right? First of all, those first responders, right? They were there to help. Now, if it were a crime scene technician taking videos and photos for use in a criminal case or to determine the at fault or anything like that, that's within the scope of practice, within the line of duty, and that I have no problem with at all. If the first responders were taking videos for that purpose, I have no problem with that at all, as long as it only gets shared to the people who need it for the purposes stated. But that's not what happened here. In this case, these first responders showed these very horrifically graphic images to other people that were completely unrelated to the issue. They shared them personally for attention. And that's really what it is when you get down to it. This was not a forensic examination of the crime scene. This was not shared with the NTSB to determine the fault of the helicopter. There was no official reason for the dissemination of this information. It was just sensational. Oh my gosh, look at this. Did you see what happened to this famous person? Look, that is, to me, sickening. It is disgusting. And I have no real words to explain how I feel about that. Because it was all in search of attention. Now, there's a million ways to get attention. You should never exploit somebody else for your own attention-seeking needs. And it sickened me. And I really hope that the jury takes all of that into consideration. Now, for me, this is how my brain works, right? So we know that this got traction, got attention, because there was a famous person on board. And we know that it was also seemed to be, an investigation seemed to be more or less not investigated properly. Because there was a famous person on board. And I think that it was one of those, well, boys will be boys type thing, and let's sweep it under the rug. And that should never, ever, ever happen. But, so this is the way my mind works. If somebody there, or multiple somebodies in this case, there were taking videos of this sensational, traumatic accident, how many others did they take and share and not get caught? This was not a one-time event. I'm willing to bet it. This is not a one-time event. And if it was, how much worse is that? That you're trying to profit off of the fact that this was a celebrity, right? So that's even more disgusting. But I'm willing to bet that this was not a one-time event. This was the one time they got caught. right? So why am I even talking about this? Well, it's in the news right now, and they're in a trial, and I'm watching the trial with anticipation to see what's going to happen here. And this is going to have an impact on medical as well, because remember, first responders are kind of in the medical arena, right? So this is going to have an impact on medical as well. So I'm keeping a close eye on it. But why am I talking to you about this? Because we do this in healthcare too, all the time, without even thinking about it. Maybe not with famous people, but with that little old lady in the nursing home, with the horrible bed sore that somebody saw on a patient, with, different things that we see that we think is interesting, and we share with other people. We don't have the right to do that. Remember that if you are sharing something without the permission of the person, right, that you're sharing it, and for your own attention-seeking behavior, then you are sharing something you don't have the right to share. Now, I have seen a lot of things on social media. I'm in a lot of CNA groups. I subscribe to a lot of news feeds about healthcare. And I've seen this quite often. And I've heard things get thrown around like, well, as long as you don't show their face, it's okay. Or if the patient says it's okay, it's okay. Or just make sure you don't say their name. Nobody will know who it is. All of those are absolutely false. Just because you have the permission of the patient does not mean that you're sharing it with individuals that have a right to that information or that need to know. It's still a HIPAA violation. If you're sharing a video of somebody and you just don't have their head in the shot, it is still a HIPAA violation. If you are sharing stuff specifically to get likes or followers or attention, it is a HIPAA violation. So the only time that you should be sharing information is with the healthcare team that's actively treating that patient, and only when it's necessary to share that information. But not because, oh my gosh, look at this. Can you believe she did this? Or Roseanne is carrying her baby doll around and she's talking to it like it's a real baby. Watch. Here, I videotaped it. That's not what we're there to do. And sometimes we forget that in this age of social media, where everything is sensationalized and the more graphic it is, the better it is, right? Sometimes we forget that these are people, real people, and that when you're sharing things about real people, there is going to be an indirect effect of that. And that's what HIPAA is all about. And it just really surprises me that HIPAA is made out to be something super complex and difficult and that we have to comply with, right? It's common decency. The fact that we had to make a law for common decency is a bit concerning to me, but it's just common decency. If you are in the hospital because you have a serious intestinal issue and you don't make it to the bathroom in time and you leave a trail of diarrhea on the floor, you probably don't want that broadcast out to the public. It's embarrassing. It's personal. And whoever's watching that doesn't have the full story, do they? So that's not really what should be happening here, right? You are counting on the discretion and the privacy and the professionalism of the people that are there to help you, to treat you. You are counting on their professionalism because you are in an hour of need. And I think that if we forget that, we're going to have a whole lot more situations like this helicopter crash photo share. And I think that this is a good reminder to all of us to check our own processes, and to try to figure out, are we sharing things with the right people at the right time for the right reason? And if the reason that you're sharing it is because you think it's cute, or you think it's disgusting, or you think it's interesting, or you think that other people would enjoy it, that's the wrong reason to share. And you're sharing it on the wrong platform. If you're sharing something because a medical personnel needs to know for treatment purposes, that's when you're allowed to share. I hope this helps kind of get you to understand HIPAA a little bit more, right? And everything we do has a profound impact on not just the patients that we care for, but also the other people that are in the orbit of the patient. So let me give you a good example of this. I personally would be very, very concerned about traveling to Los Angeles and getting into some sort of an accident, because now I don't know if those first responders are there to help me or to profit off of me, right? I'm now going to look at them with suspicion because I don't know what their motives are. And we have to understand that your patients will also look at you with suspicion if healthcare doesn't get this right. They're vulnerable, and we need to be professional. That's the whole purpose of this. So I hope that helped you guys. I hope it gets you to see HIPAA a little bit differently. It's not something that we have to comply with because it's a rule and you could get fined, and it's common decency. It's the whole patient healthcare worker confidentiality thing. It's just being a good human. So if you look at HIPAA as being a good human, it'll kind of rearrange the way you see it. I hope that helped. All right, guys, let's see who's here. Hi, Tina. Hi, Sophie, watching from Kenya. Hi. Hi, Octavia. Hi, Petronella. First time here. Well, welcome. Hello, Miami Bar Life. Hi, Thanisha. First time here. Welcome. Hello, Gloria. Thanks for coming back. Blue says, dealing with the finer points of HIPAA law makes me twitchy. Yeah, Blue, you can get in the weeds with HIPAA, but it really is super easy. Don't share anything with anyone that does not need it for a treatment decision. It really is that simple. Anything. Not, names, addresses, phone numbers. So here's another one that was interesting. A couple of years ago, a person working at a doctor's office got a phone number of a patient to pass it along to somebody else who was interested in buying an item from that patient, right? Nothing to do with healthcare at all. Nothing at all. But took her access to the phone number because of her medical position and passed it on to somebody who had absolutely no relationship there at all. And that is a HIPAA violation. Even it's a phone number. It's a phone number, but it's still a violation of the professional standards. She didn't have the right to pass that on, right? So the finer points of HIPAA, it really does boil down to, if the person that you're giving this information to does not need it for a treatment decision, you don't need to be sharing it. It's that simple. Nothing, absolutely not the color of their shoes. Nobody needs to know what the color shoes are in room 210. That there's no need for anybody to have that information. So don't pass it on. Even if you like those shoes, don't pass it on. So, HIPAA really is way easier than the people try to make it out to be. Carmeline says, hi, I have my test on Tuesday the 23rd. Oh, Carmeline, we're going to send you good vibes. You're going to do fantastic on the test. And let us know how you do so we can congratulate you. I've got a couple people to congratulate in a little bit. Tina says, my question today is, if I need to raise the patient's bed to perform a task, at what point should that be done? before or after I wash my hands? Oh man, that is a really, really, really good question. And this comes up quite often in my training. So I'm going to answer this in two ways. Okay, so first we're going to talk about Prometric testing. So Prometric testing, a lot of states use Prometric, and Prometric does not require that the bed be raised for any skill. You can if you want to. There's no problem with it. But there's no requirement that the bed is raised up to a comfortable working height. But if you do raise the bed, you must remember to lower it at the end of the skill. Otherwise, it's an automatic fail. And that has to do with the floor. And people get this mixed up too. When you get into bed at night and you swing your legs in and you go to sleep and you wake up the next morning and you're super groggy and you're not really paying attention to anything because you're not even really awake yet, and you swing your legs out, that floor is always right where you left it. So when you swing your legs out, you put your weight down to stand up because you expect that floor to be there. It has always been there. It's never moved a day in your life. It's predictable. Now, when we come along and raise the bed up to a comfortable working height, what we did was move the floor. And the patients never, ever, ever experienced that. The floor has never moved in their life. So when they go to get out of bed and they swing their legs out and that floor is not where they left it, well, they're still putting their weight down because they expect it to be, and that's how falls happen. So if you raise the bed up to a comfortable working height, you have to remember to lower it to the lowest point. That way the floor is right where the patient left it, and they're less likely to fall when they go to stand up out of the bed. But when do you raise the bed up? Now, either way is fine. You can raise the bed before you go wash your hands. You can raise the bed after you wash your hands. But what we're talking about here really has to do with infection control, right? Because we know the bed controller is not clean. Anybody has had access to that bed controller. Patients, visitors, staff members, everybody has had access to that bed controller. We know it's not clean. So the best time to raise the bed is before you wash your hands. While you're at the bedside doing your opening, hit the button, raise the bed, as long as that sink is not too far away, right? Now, if you have to go out of the room, down the hall, and wash your hands and get your supplies, and you're leaving the patient bedside area, then don't raise the bed before you wash your hands, because you don't want something to happen and the patient try to get out of bed. So you need to, if you're going to raise the bed, you need to remain in the patient environment. That way you're there to help them should something happen. So if you're going to be there, raise the bed before you wash your hands. If you have to leave, then you're going to raise the bed when you come back. But you've got clean hands. So how do you do that without cross-contamination? Get a paper towel and use the paper towel between your hand and the bed controller as a barrier. And that way you can raise the bed up to a comfortable working height without grossly contaminating your hands. And that will help with that infection control issue. Remember, at the end of the skill, you always have to lower the bed back down, though, to the lowest position so that it's safe for the patient to get out of bed should they wish to. Okay, I hope that helps. Yes, Blue, I absolutely agree. The accident photos should never have been made public, and the first responders should not have released those accident photos. I absolutely 100% agree. And I really think that it points to their lack of professionalism. And sometimes that happens with medical personnel. We get so jaded. We start to forget the humanity aspect of healthcare. And that's just not a good situation. So I think we all need a periodic check. Just a reminder, hey, are you remaining professional or have you become a little jaded? So I think that we all need that from time to time. And I really think that that's the purpose of addressing HIPAA and confidentiality with continuing education. It's just a way for us to kind of think about our own processes and make sure that we haven't let some of the monotony and the routine cloud our judgment. I hope that helps.